All right, before we dive into this crazy story, do me a favor. Subscribe and tell us where you're watching from. The emergency department at Harborview Regional never truly slept. At 1:41 a.m., the hospital existed in that strange space between exhaustion and vigilance. Fluorescent lights hummed overhead with a dull electric buzz. Rain rattled the ambulance bay doors in quick bursts as wind pushed against the building from the harbor. Most of the city slept. Inside the trauma floor, fatigue had become routine. Nora Vance stepped through the staff entrance quietly and clipped her badge to the pocket of her scrub top. Her movements were careful and deliberate, the way someone moved when they knew people were already watching for mistakes. The night shift board was already full. 2 residents leaned over the central station, arguing softly about imaging orders. The charge nurse scribbled adjustments to assignments while half-drunk coffee cooled beside the computer monitor. No one looked up when Nora arrived. That at least was familiar. She checked the supply cart beside the trauma bay first. It was a habit she had learned long ago. Look at the room before the room looks at you. The suction tubing had been attached incorrectly. The pressure seal sat loose against the wall port, something that would have failed the moment a real bleed demanded full draw. Nora corrected it quietly. Across the room, one of the senior nurses glanced at her and shook her head faintly. "She does that every shift," the nurse said to a resident. The resident didn't even look up from the chart in his hands. "Because she thinks slower than the rest of us." The comment earned a quiet laugh. Nora heard it. She didn't react. Instead, she opened the medication tray beneath the cart and scanned the labels automatically. A vial of epinephrine had been placed in the wrong row. The label had been turned just slightly off alignment, the dose indicator facing the wrong direction. A small mistake, the kind that only mattered when seconds counted. She moved the vial to the correct slot and closed the tray again. From the other side of the station, the charge nurse called out, "Vance." Nora stepped closer. "You're covering overflow beds tonight. Minor cases, discharges, paperwork." The words were spoken the way someone might assign supply inventory, not patient care. Nora nodded. "Yes, ma'am." The charge nurse tapped the clipboard once. "And stay out of the trauma bays unless someone asks for you. We don't need hesitation in a critical room." A resident nearby added, "She hesitates because she's thinking too much." More quiet laughter. Nora kept her hands folded lightly behind her back. It was not the first time someone had said that about her. In another life, hesitation had meant something different. It had meant measuring risk before movement, counting variables before speaking. But here it looked like uncertainty. And uncertainty was something trauma teams disliked. One of the trauma bays lit up as paramedics rolled in a patient with chest pain. Nurses moved around the stretcher quickly, voices overlapping in familiar rhythm. Nora stepped toward the room automatically. The charge nurse stopped her with a glance. "We've got it." The words were calm but final. Nora stepped back. Instead, she turned toward the supply cart beside the hallway beds and began checking tubing connectors one by one. Across the department, Dr. Alan Mercer, the senior trauma attending that night, walked into the ER from the surgical corridor. His presence carried a quiet gravity that shifted the posture of the residents immediately. Mercer's reputation had been built on speed, decisions made fast, procedures done faster. He glanced toward the hallway where Nora worked and frowned slightly. "That the new one?" The charge nurse nodded. "Rookie rotation. Careful to a fault." Mercer studied Nora for a moment as she replaced a loose oxygen connector on a portable tank. "She looks like she's waiting for permission to breathe." Another small laugh circled the desk. Mercer turned back to the board. "Keep her off anything complicated." Nora finished tightening the oxygen line and placed the tank back into its rack. She had heard that comment too. Still no reaction. Instead, she continued checking the rest of the cart methodically. A trauma floor always revealed its weaknesses before the crisis arrived. You just had to look for them. The rhythm of the ER continued quietly for another 15 minutes. Monitors chimed. Rain struck the glass harder. Somewhere down the hallway, a patient coughed behind a curtain. Then the radio on the wall crackled to life. Every voice in the room stopped. The dispatcher's tone was clipped and direct. "Harborview Regional inbound trauma. Military patient." Male, mid-30s, penetrating side wound with heavy blood loss. The room shifted instantly. The resident straightened. The charge nurse stepped closer to the radio. Transport time? 3 minutes. The dispatcher paused before finishing the report. One more note. Patient accompanied by active military canine. Animal currently agitated and refusing separation from handler. For a second, the trauma floor was completely silent. Someone near the station muttered, "A dog?" Security looked up from the hallway desk. Dr. Mercer frowned. "Animal control?" "Not enough time," the charge nurse replied. Across the room, Nora stopped adjusting the supply tray. Her eyes lifted slowly toward the trauma bay doors. Military working dog, agitated. Still attached to the handler? She said nothing. But somewhere deep in her memory, a quiet part of her mind had already begun calculating the next 3 minutes. The ambulance doors slammed open against the rain. Cold air rushed through the ambulance bay as paramedics burst through the trauma entrance, pushing a stretcher at full speed. Their boots left wet tracks across the polished floor. "Penetrating wound right side," one of them called. "Heavy blood loss." The trauma team moved instantly. Monitors lit up. Nurses reached for gloves. The charge nurse stepped forward to guide the stretcher toward Trauma Bay 1. But the team slowed before they even reached the bed, because something else came through the doors with the patient. A large military working dog moved beside the stretcher, tethered by a thick harness strap twisted around the wounded man's hand. The animal's body pressed tightly against the patient's torso as if shielding him. The dog's eyes tracked every person in the room. Not wild, not confused, focused. The wounded man on the stretcher was barely conscious. Blood soaked through the right side of his tactical jacket and ran down the edge of the gurney in thin, dark lines. One of the paramedics spoke quickly as they rolled the bed into position. Male, mid-30s. Possible Navy special warfare. Found with working dog attached. Handler refused separation. The patient groaned faintly but did not open his eyes. The dog's head snapped toward the nearest doctor as he stepped closer to the bed. The low sound that came from its chest was not loud, but it stopped the entire room. Dr. Mercer stepped forward with authority. "Get that dog restrained." The words landed hard. Security moved instantly from the hallway. 2 guards approached from opposite sides, cautious but firm. The dog's posture changed immediately. Its body lowered slightly, not retreating. Preparing, the first guard reached for the harness. The dog lunged. The movement was explosive and precise. Teeth snapped inches from the man's arm. The guard jumped backward as the animal drove him away from the stretcher. The entire room froze. "Back up," someone shouted. The dog planted its paws beside the patient's torso again, shoulders rigid, head low. Protecting, not panicking. Dr. Mercer's patience snapped. "Sedate the animal." A resident already had a syringe half prepared, but the paramedic closest to the stretcher shook his head quickly. "That's a military canine. If you miss the dose or spook it—" "We don't have time," Mercer cut in sharply. Another security guard stepped forward, trying a different angle. The dog snapped again. This time the teeth caught the air inches from his wrist. The guard stumbled back immediately. Across the room, the patient's monitor chimed sharply. Blood pressure dropping. Heart rate climbing. The man on the stretcher tried to move weakly, his hand still twisted through the harness strap. The dog pressed closer to him, blocking the wound completely. "Move that animal!" Mercer barked. No one moved. The room had reached a dangerous stalemate. No one could treat the patient. No one could reach the wound. Every attempt to get closer made the dog react harder. Rain hammered against the glass doors behind them. Seconds slipped away. Near the back wall of the trauma bay, Nora Vance watched the scene quietly. She had not stepped forward when the stretcher first arrived. No one had asked her to. Instead, she studied the animal, its shoulders, the angle of its ears, the way its weight rested against the man's chest. The dog was not attacking randomly. It was guarding. Specifically the handler's torso, specifically the wound. The animal's eyes flicked between people as they moved too quickly around the room. Too loud, too close. Every step forward looked like a threat to the handler it had been trained to protect. Nora noticed something else. The dog never lunged until someone reached toward the patient. It wasn't defending space. It was defending access. The distinction mattered. Across the room, Mercer's voice grew harsher. "Security, restrain it." The guards looked uncertain now. One wrong move could end with someone bitten. Or worse. The monitor alarm sounded again, blood pressure falling further. The paramedic at the head of the stretcher wiped rainwater from his face. "He's losing too much blood." Still, no one could reach him. The dog remained planted over the handler's torso like a living barrier. Nora's eyes shifted to the patient. The blood pattern told its own story. Right side wound, deep. Too much blood for the delay already passing. She calculated the time quickly. 2 minutes, maybe 3 before shock took over completely. The room was still arguing about the dog, not the bleeding. Nora inhaled slowly. Her gaze returned to the animal. Its breathing was steady, controlled, waiting for someone to prove they were not the enemy. She understood the pattern now. The team saw a threat, but the dog saw only one thing: a wounded handler surrounded by strangers. And every second the room hesitated, the handler was bleeding closer to death. The trauma bay had stopped functioning like a hospital room. It had become something closer to a standoff. The wounded SEAL lay half-conscious on the stretcher, blood still seeping steadily through the right side of his tactical jacket. The monitor beside him beeped with a rhythm that was growing thinner with each passing minute. But no one could reach him. The military working dog remained pressed against the handler's torso, shoulders squared, eyes moving between every person in the room. Waiting, watching. Dr. Mercer stepped forward again, frustration rising in his voice. "Enough of this." The authority in his tone carried across the room. "We need access to that wound." His voice rose slightly as he pointed toward the animal. "Get that dog under control." The increase in volume changed the room immediately. The canine's head snapped toward him. Its posture tightened, ears forward, teeth barely visible beneath the lifted edge of its lip. The animal didn't lunge, but the message was clear. Too loud, too close. Across the trauma bay, one of the residents muttered nervously, "We could sedate it." Another voice answered quickly, "With what dose?" "That's a trained military dog?" A nurse near the supply cabinet whispered, "Call animal control." Someone else said, "Taser it if it charges." Every suggestion came faster than the last, each one worse than the one before it. The room had started reacting instead of thinking. Security hovered near the doorway again, uncertain whether to move forward or stay back. The dog noticed every shift, every step, every raised voice, and every reaction tightened the invisible circle around the patient. Nora stood near the edge of the trauma bay, just outside the reach of the dog's focus. Her eyes moved between the animal and the monitor beside the stretcher. Blood pressure was slipping again, heart rate climbing. The patient's breathing had grown shallower. He would not survive much longer without intervention. The delay was killing him. But the wrong move would trigger the dog, and if the dog attacked, the room would respond with force. The chain reaction would be fast. Security would act. Someone would reach for a weapon. The dog would be injured. The patient would be exposed. And the trauma team would lose control of the entire situation. Nora's mind ran through the possibilities quietly. There was a pattern to the animal's behavior. It reacted to 3 things: volume, crowding, hands reaching toward the handler. Each mistake repeated itself every time someone moved. Dr. Mercer's patience had run out. "Sedation," he ordered sharply. "We're not wasting another minute." The resident lifted the syringe again, but the paramedic near the head of the stretcher shook his head. "That dog's bonded to him. You hit it wrong, and it'll go through someone's throat before it drops." Mercer's jaw tightened. "We cannot treat the patient like this." No one disagreed, but no one had a solution either. Nora stepped a little closer to the supply counter, not toward the dog, just enough to see the patient's chest more clearly. The SEAL's breathing had grown uneven. His hand still gripped the harness strap attached to the animal's vest. Even unconscious, the connection remained. Nora noticed something else. The dog's body was positioned deliberately, not just guarding randomly. It covered the exact point where the blood was spreading beneath the jacket. The dog wasn't protecting the man's face or his arms. It was protecting the wound. The realization settled quietly in Nora's mind. The animal had been trained for this. Protect the handler. Protect the injury. Keep strangers away until a trusted command arrived. Across the room, the residents were still arguing. Taser would drop it instantly. And what happens if it bites someone first? Animal control is 20 minutes out. We don't have 20 minutes. The voices overlapped again. The dog's head turned rapidly between them. The tension in its shoulders grew tighter. Nora spoke for the first time. Her voice remained calm. "Who's the handler?" The question was simple. No one answered. Mercer didn't even look at her. "We're not discussing the dog," he said sharply. "We're treating the patient." Nora didn't react. Instead, she looked at the paramedic. "Did the unit say anything about handler commands?" The paramedic opened his mouth slightly, but Mercer cut in immediately. "Vance, step back." The words carried clear authority. "You're not part of this decision." Nora fell silent again, not because she agreed, because she was calculating. The dog shifted slightly beside the stretcher, still guarding, still waiting. Across the trauma bay, a nurse reached for a tray of instruments. The metal clattered loudly against the cart. The dog's head snapped toward the sound. For a moment the room held its breath. The animal didn't lunge, but the tension in its muscles deepened. Nora moved quietly then. She stepped to the instrument cart and slid the tray farther away from the bed. The metal tools stopped clinking. Then she shifted a second tray farther back against the wall. No one noticed the adjustment. But the room became slightly less chaotic, less threatening. The dog's posture eased by a fraction. Across the room the monitor chimed again. The sound was sharper this time, blood pressure dropping. The patient's chest rose weakly against the harness strap. The paramedic looked at the screen. "He's crashing." For a moment no one moved, because the truth had arrived. They could not treat the wound, and without treatment, the man on the stretcher would bleed out in front of them. The room had reached its decision point, and Nora Vance understood something the others still hadn't. The only way to reach the patient was through the dog. The trauma bay had reached the edge of collapse. Voices overlapped again as the residents argued about sedation and security options. The charge nurse tried to quiet the room, but every second that passed made the tension worse. The wounded SEAL lay motionless on the stretcher, except for the shallow rise of his chest. The monitor chimed again, blood pressure slipping, heart rate climbing. The dog remained locked beside him, shoulders rigid, eyes tracking every movement in the room. Everyone was focused on the animal. No one was reaching the wound. Near the back wall, Nora watched the scene with stillness that looked almost passive. But inside, her mind had already reached its conclusion. The dog wasn't out of control. It was following a rule. Protect the handler. Reject strangers. Wait for a command it recognized. The room had given it none. Another alarm sounded from the monitor. The paramedic at the head of the stretcher muttered quietly. "He's not going to last much longer." Across the trauma bay, Dr. Mercer snapped again. "Sedate the animal now." The resident raised the syringe. The dog noticed. Its body lowered. The movement was small, but the message was unmistakable. One more wrong step and the room would explode. Nora inhaled slowly. Then she stepped forward. The movement itself drew attention. The charge nurse looked up immediately. "Vance!" But Nora was already moving toward the bed. She did not rush. She did not approach directly. Instead, she angled her body slightly sideways as she came closer, presenting less of herself as a threat. Her hands stayed visible at waist level. "Palms open!" The dog's eyes snapped toward her instantly. The animal studied her posture, the way she moved. Not fast, not challenging, measured. The room fell quiet. Even Mercer stopped speaking for a moment as the rookie nurse stepped closer to the animal everyone else had been afraid to approach. Nora stopped a few feet from the stretcher, close enough for the dog to see her clearly, not close enough to trigger defense. The canine's muscles remained tense, but it did not lunge. It watched her. Nora lowered her voice. Not loud, not commanding. Steady. Her breathing remained slow and even as she spoke. The words she used were short, precise. Not English, a military code phrase meant for working dog recognition during medical evacuation. Guardian protocol. Medical control. The sound of the words cut through the room like a quiet blade. For a second, nothing happened. Then the dog reacted. Its head tilted slightly. The tension in its shoulders shifted. The animal stepped sideways. Just one step, then another, not retreating completely. but clearing the exact space where the blood had soaked through the SEAL's jacket. The path to the wound opened. The room froze. No one spoke. No one moved. The only sound in the trauma bay was the steady beeping of the monitor beside the stretcher. The dog remained beside the handler, but its posture had changed. Alert, watching, but no longer blocking access. The transformation was immediate. The impossible problem that had paralyzed the entire room had vanished in a single moment. Dr. Mercer stared at Nora. "What did you just say?" Nora didn't answer, because the moment the dog stepped aside, her focus shifted instantly to the patient. She moved to the stretcher without hesitation. "Pressure kit," she said calmly. The charge nurse blinked as if waking from a trance. Then she handed the tray over. Nora cut through the soaked fabric of the tactical jacket with steady hands. The wound beneath it was worse than the blood pattern had suggested. Deep. Right side, bleeding hard, but now she could see it. And seeing it meant saving him was still possible. "Direct pressure," she said quietly. The paramedic moved immediately. Nora reached for the suction line she had fixed earlier. The tubing responded perfectly. Blood cleared from the wound. The dog stood beside the bed watching her every movement. Not interfering, not threatening, just observing. Dr. Mercer stepped closer again, confusion still visible in his expression. "Vance, how did you—" She didn't look up. "Clamp!" The instrument appeared in her hand as the nurse passed it forward. Nora worked quickly now, movements precise and efficient. Every second counted. The room slowly began moving again around her. Residents repositioned equipment. The charge nurse adjusted the monitor leads. Security stepped farther back toward the doorway. The dog remained at Nora's side, calm, focused, watching only her. Mercer stood beside the bed for a moment longer, still waiting for an explanation. Finally, he said it again. "What code did you use?" Nora secured the pressure clamp and checked the bleeding again before answering. Her voice remained calm. "I'll explain later." But the truth behind the words was clear. She wasn't going to explain at all, because the window the dog had given them was already closing. And Nora Vance had no intention of wasting it. The moment the dog stepped aside, the entire tempo of the trauma bay changed. Seconds earlier, the room had been frozen. Now everything moved again. But the rhythm was different. Nora did not raise her voice. She did not announce authority or argue for control. She simply began issuing instructions in a calm, precise cadence that cut through the lingering chaos. Pressure steady. The paramedic pressed harder against the wound. More suction. A nurse adjusted the line Nora had already prepared earlier. Blood ready. The charge nurse moved to the cooler beside the cart. Each instruction was short, specific, delivered without hesitation. People obeyed almost automatically, not because Nora demanded it, but because the clarity in her voice gave them something the room had been missing: direction. The dog remained beside the stretcher, close enough that its shoulder brushed the edge of the bed, but it no longer blocked access. Its attention never left Nora. Every movement she made, the animal tracked with quiet focus. Not tense, not defensive. Watching, trusting. Nora ignored the attention. Her focus remained on the wound. The bleeding was heavy but not uncontrolled. The clamp had slowed the flow enough to expose more of the injury beneath the torn fabric of the tactical jacket. A resident leaned closer, studying the damage. "Entry wound here," he said quickly. "That's the main bleed." He reached toward the visible injury. Nora's hand stopped him. "Not yet." The words were quiet but firm. The resident frowned. "That's where the blood is coming from." Nora didn't argue. Instead, she shifted the suction slightly and cleared another layer of blood away from the wound. The deeper pattern appeared. The bleeding on the surface wasn't the primary threat. The real danger sat just beneath the rib line, where the blood flow pulsed in a deeper rhythm. "Priority is here," Nora said calmly, pointing with the clamp. The resident stared. "That's not where the damage is." "It is." She didn't raise her voice, but the certainty in her tone carried weight. Across the bed, Dr. Mercer studied the wound more carefully now. The rhythm of the bleeding matched what Nora had seen first. He said nothing. The resident, however, did. "You're guessing." Nora's eyes never left the patient. "Clamp extension." The nurse passed the tool immediately. The resident's frustration sharpened. You don't even know the full injury profile." Nora finally looked at him, only for a moment, long enough to stop the argument before it started. "Hold the suction." The instruction was direct. The resident hesitated, then obeyed. Because the monitor beside the bed chimed again, the patient's blood pressure was still dangerously low. There was no time for debate. Nora adjusted the clamp position slightly. The bleeding slowed another fraction. Not stable yet, but closer. Across the trauma bay, the paramedic exhaled quietly. "That's better." The resident stared at the wound again. Now the deeper source of blood was obvious. Nora had identified it before anyone else had even seen it. Mercer folded his arms, watching, listening. The cadence of Nora's instructions continued. "Second unit blood." The charge nurse connected the line. "Keep pressure constant." The paramedic nodded. "Monitor oxygen." The respiratory tech stepped closer. Every command came in the same rhythm. Short, clear, ordered. Not the chaotic burst of civilian emergency rooms. Something else. Something older. Mercer recognized it first. The sequence wasn't academic. It wasn't the way most hospital trauma teams communicated under pressure. It sounded more like a battlefield triage line. Structured, disciplined, minimal words, maximum action. Across the bed, the dog remained perfectly still, watching Nora as if waiting for the next instruction. The animal's calm presence now seemed almost surreal compared to the chaos from minutes earlier. Nora finished tightening the clamp and studied the patient again. The bleeding had slowed. The blood pressure began to rise slightly on the monitor. Only a small change, but enough to buy time. The SEAL's breathing steadied as oxygen flowed through the mask. His eyelids fluttered faintly. Alive. Still in danger, but alive. Nora stepped back slightly to reassess the full injury pattern. That was when she noticed something else. The wound alone didn't explain the way the patient had deteriorated so quickly earlier. The blood loss was severe, but something else had triggered the crash. Her eyes shifted toward the tactical vest, still partially attached to the SEAL's torso. The dog's earlier guarding behavior suddenly made more sense. The animal hadn't just been protecting the man. It had been protecting something specific on the handler's body. Nora leaned closer again, carefully examining the equipment clipped along the vest's interior seam. A small, reinforced pouch sat partially hidden beneath the harness strap. Unusual placement, deliberate. Her mind ran through the possibilities instantly. Across the trauma bay, Mercer noticed her pause. "What is it?" Nora didn't answer immediately, because the problem unfolding in front of her was no longer just a medical emergency, and the dog had known it before anyone else in the room. For a few seconds after the bleeding slowed, the trauma bay finally felt stable. Not safe, but stable enough that the alarm stopped shouting and the room could breathe again. Nora kept one hand near the wound, watching the clamp carefully while the bloodline flowed into the patient's arm. The color had begun to return faintly to the SEAL's face beneath the oxygen mask, but something still felt wrong. The pattern of the crash earlier had been too fast, too sharp. Blood loss alone did not explain the way the patient had deteriorated in seconds. Nora's attention shifted back to the tactical vest, still strapped to the SEAL's torso. The reinforced pouch she had noticed earlier sat half hidden beneath the harness strap that connected the dog to its handler. The dog's earlier behavior suddenly made perfect sense. It had not just been protecting the man, it had been guarding that exact area of the vest. Nora leaned closer. The pouch was sealed with a thick pressure clip, the kind designed to survive combat environments. Dr. Mercer noticed her focus. "What are you looking at?" Nora didn't answer immediately. Instead, she gently slid the edge of the vest fabric aside, revealing more of the pouch. The paramedic near the head of the stretcher saw it too. That wasn't mentioned in the field report. Mercer stepped closer. "Remove the gear." The instruction came quickly, the way hospital procedure demanded. But Nora spoke before anyone touched it. "Wait." Her voice remained calm, not loud, just firm enough to pause the movement. Mercer frowned. "It's equipment. We remove it." Nora kept her hand lightly on the vest. "Not yet." The resident beside the bed looked irritated. "You're worried about his jacket while he's bleeding out?" Nora shook her head. "No." She pointed at the pouch. "That." The room studied the reinforced compartment more carefully now. The stitching was heavier than normal gear pockets. The placement sat directly against the injury site, and the dog had defended it with absolute focus. The paramedic spoke quietly. That might not be medical equipment. Mercer's tone sharpened. All the more reason to get it off him. He reached for the vest. Nora's hand stopped him again. "Sir." The word carried respect, but also certainty. "If that pouch contains what I think it might..." She paused just long enough to choose her words carefully. Pulling it open blindly could cause a bigger problem than the wound. The room fell quiet again. Security near the doorway exchanged glances. The resident scoffed. "You're speculating." Nora looked back at the dog. The canine stood perfectly still beside the stretcher, watching only her. The animal had allowed treatment, but its attention remained locked on the pouch. That detail confirmed Nora's suspicion. The dog had been trained to guard it, not randomly, deliberately. Mercer studied the vest again. "What exactly are you suggesting?" Nora inhaled slowly. This was the moment she had hoped to avoid, because the knowledge required to handle situations like this did not belong to rookie ER nurses. But ignoring it could cost lives. "The pouch might contain mission equipment," she said carefully. "Sensitive gear." The paramedic nodded slowly. "That tracks." Mercer crossed his arms. "And you know that how?" Nora didn't answer the question. Instead, she shifted her attention back to the patient. The SEAL's breathing had become uneven again. Not collapsing yet, but fragile. "Right now, the priority is stabilizing him," she said. She adjusted the clamp slightly and checked the wound again. Removing the vest aggressively could reopen the bleed. That part was pure medical logic. But Nora knew the second risk as well. Some operational gear carried internal safeties. Pressure triggers. Secure compartments. Mercer looked unconvinced. "We're not running a military operation here." "No," Nora said calmly. "But we're treating someone who came from one." The resident shook his head. "You're making this more complicated than it is." Nora ignored the comment. Instead, she moved quickly, adapting the next step in the stabilization sequence. Padding. The nurse handed her sterile gauze. Nora placed it carefully between the vest edge and the wound to reduce movement pressure. Then she secured the area with controlled compression, rather than removing the equipment outright. It was a technique used when removing gear too quickly could destabilize an injury. Field medicine, adjusted for a hospital environment. Mercer watched her closely now. The rhythm of her movements. The way she balanced patient care with the unknown variable in the vest. The resident noticed it too. "Where did you learn to do that?" Nora didn't answer. She checked the monitor again. Blood pressure improving slightly. Heart rate still high but stabilizing. The patient's body was responding. Across the trauma bay, the paramedic spoke quietly. "That dog trusted her before any of us." The resident looked back at Nora again, then at the vest, then at the dog. Finally, he asked the question everyone in the room was thinking. "Who exactly are you?" The trauma bay had finally settled into a fragile rhythm. Blood continued flowing through the transfusion line. The compression around the wound held steady. The patient's vitals had improved enough that the alarms no longer screamed every few seconds. But the room itself had changed. People were watching Nora now, not the way they had earlier. Earlier they had watched for mistakes. Now they were trying to understand her. The resident who had questioned her earlier still stood beside the bed, staring at the stabilization work around the vest and wound. Across the room, Dr. Mercer folded his arms again. His voice carried less frustration now, but something sharper. "Vance." Nora glanced up briefly. "You're a rookie nurse on rotation." It wasn't a question. "But you're handling a military working dog, identifying operational equipment and running a trauma sequence like you've done it before." The room had gone quiet again. Nora returned her attention to the wound. "Clamp pressure is holding." She adjusted the gauze slightly and checked the patient's breathing again. Mercer did not move away. "Where did you learn that?" Before Nora could answer, the doors to the trauma bay opened again. Two figures stepped inside. The first was a hospital administrator in a dark suit, his expression tight with concern. The second man moved differently. Short hair, neutral clothing, but his posture carried the quiet alertness of someone used to operational environments. The paramedic near the stretcher recognized him first. "Military liaison." The administrator spoke quickly. "We were notified about the incoming patient." His eyes moved immediately to the canine, then to the wounded SEAL, then finally to Nora, standing beside the bed. The liaison studied the room silently. His gaze paused on the dog, then on the vest pouch Nora had left secured. Finally, he looked at Nora herself. "Who issued the Guardian Protocol?" The question landed calmly, but it carried weight. Dr. Mercer answered first. "She did." He nodded toward Nora. "Your nurse spoke some kind of code phrase, and the animal stood down." The liaison's eyes sharpened slightly. He turned back to Nora. "What exactly did you say?" Nora kept her hands steady on the patient's bandaging. "Medical identification code." "That's not civilian protocol." "No." The liaison studied her face carefully, because the phrase she had used earlier was not just military. It was specific, used in certain joint operations environments where medical personnel needed to establish safe access to working dogs under combat conditions. Not knowledge a hospital nurse would normally carry. Across the room, Mercer spoke again. "You see the problem." His tone had shifted. Less confusion, more accusation. "She's interfering in a sensitive military case and refusing to explain how she knows operational procedures." The administrator frowned slightly. "Dr. Mercer." But Mercer continued. "This is outside hospital protocol." His eyes returned to Nora. "You don't just improvise codes in a trauma room." The dog shifted slightly beside the stretcher. Not aggressive, but alert again. The moment the conversation started turning hostile, the animal's attention snapped back toward the voices. The liaison noticed. Then he looked at Nora again. "Stay where you are," he said quietly. The instruction was directed at the room, not Nora. The dog relaxed again immediately. Another small detail, another confirmation. Mercer noticed the shift. The animal only responds to her. The liaison nodded faintly. "That appears to be correct." Across the trauma bay, the patient groaned weakly. His chest rose sharply beneath the oxygen mask. Nora's focus returned instantly to the monitor. Blood pressure dipping again, not dramatically, but enough to tighten her expression. The earlier stabilization had bought time, not safety. The resident noticed the monitor too. "He's dropping again." The room's tension shifted immediately. The personal questions stopped mattering. The patient came first. Nora adjusted the compression slightly and checked the wound again. The blood flow had increased again beneath the clamp. The second complication she suspected earlier was beginning to show itself. Mercer stepped closer. "What's happening?" "Internal pressure change," Nora said calmly. Bleeding pathway shifted. The resident frowned. "But we already clamped the primary source." Nora shook her head slightly. That wasn't the only one. She reached for another tool. The nurse handed it over without hesitation now. The liaison stepped back toward the wall, watching quietly. The administrator stopped speaking entirely, because the room had returned to the only thing that mattered. Saving the man on the bed, Nora leaned closer to the wound. Her voice remained steady. "Prepare for secondary control." The resident looked confused. "What secondary?" The monitor alarm cut him off. Blood pressure dropping faster now. The patient's breathing grew shallow again. The fragile stability had collapsed. And suddenly, no one in the trauma bay cared anymore about who Nora Vance used to be. The monitor alarm sharpened. Blood pressure fell again in a sudden, dangerous drop. The fragile stability Nora had created minutes earlier had broken. The SEAL's breathing grew shallow beneath the oxygen mask. A thin tremor passed through his chest as his body fought to maintain circulation. Nora watched the numbers for 2 seconds. That was all she needed. The bleeding had shifted deeper. Not a full rupture, but a secondary pathway had opened behind the initial clamp. The vest pressure and internal movement had changed the flow. If it continued another minute, the patient would lose too much blood to recover. Nora's mind moved quickly. There was still a window, a small one. She leaned closer to the wound again and adjusted the gauze slightly to expose the deeper angle beneath the rib line. Yes, there it was. The second source. Harder to reach, but not impossible. "Secondary bleed confirmed," Nora said calmly. The resident beside her blinked. "You can see it?" "Yes." Dr. Mercer stepped closer again. "What's the solution?" Nora's eyes never left the wound. "Compression won't hold it." The bloodline beeped again as the transfusion continued. "We need internal pressure control." Mercer frowned. In the ER? We don't have time for surgery prep. The words landed evenly, not challenging, just factual. The resident looked uncertain. That's not standard here. Nora finally glanced up. Neither is this situation. For a moment, Mercer hesitated. He had spent years commanding trauma rooms, but the rhythm of the case had shifted. The dog, the vest, the hidden complication, and the nurse standing beside the patient who seemed to understand all of it before anyone else. "What exactly are you proposing?" Mercer asked. Nora spoke calmly. "Targeted pressure stabilization beneath the rib line." The resident frowned. "That's dangerous." "Yes." Nora didn't argue the point. "But it's the only way to stop the bleed before surgery." Mercer studied her expression. She wasn't guessing. That much was clear. "How long would it hold?" "Long enough to reach the OR." The room fell quiet again. Everyone understood what the moment required. Mercer's hesitation lasted one more second. Then Nora moved. Not recklessly, not dramatically, just decisively. "Sterile kit." The nurse placed it into her hand immediately. Nora cleaned the area again and adjusted the clamp angle slightly to create access beneath the rib margin. The resident stepped closer. "You've done this before." Nora didn't answer. Instead, she spoke the next instruction. "Hold the suction steady." The resident obeyed. Her hands moved with precise control as she inserted the stabilizing instrument along the injury pathway. The movement required exact pressure. Too shallow and it would fail. Too deep and it could cause catastrophic damage. The room held its breath. Even the dog remained perfectly still beside the stretcher. The canine's eyes never left Nora. Trusting, watching, waiting. Nora adjusted the pressure carefully, then locked the instrument into place. For a moment, nothing changed. The monitor continued its unstable rhythm. Then the bleeding slowed, not gradually, immediately. The deeper flow stopped spreading beneath the gauze. The blood pressure line began climbing slowly on the screen. The resident stared at the monitor. That worked. The respiratory tech checked the oxygen again. Vital stabilizing. Mercer stepped closer to confirm the wound control. The bleeding had been contained, not permanently, but long enough. Nora leaned back slightly. "Prepare transfer." The charge nurse nodded. The surgical team upstairs had already been alerted. The SEAL's chest rose more evenly now beneath the oxygen mask. His pulse strengthened slightly under the monitor lead. The corner had been turned. Fragile, but real. Across the room, the military liaison had watched the entire intervention without speaking. Now he stepped forward quietly. His eyes moved from the wound to the instrument placement, then to Nora. "That technique," he said calmly. Mercer looked up. "What about it?" The liaison studied Nora for another moment. "Field trauma stabilization." The words hung in the air. Not accusation, recognition, used in forward operating environments. The resident looked confused. "In hospitals?" "No," the liaison said quietly. "Not in hospitals." His eyes returned to Nora, and certainly not by rookie ER nurses. Nora removed her gloves and disposed of them calmly. She did not respond. Because the patient was still alive, and that was the only outcome that mattered. The monitors finally held steady. Not strong, not safe, but stable enough that the alarms stopped shouting through the trauma bay. The transfusion line continued feeding blood into the SEAL's arm. The stabilizing instrument Nora had placed beneath the rib margin held the deeper bleeding in check. The patient's breathing was still uneven, but the sharp collapse from minutes earlier had passed. The surgical team upstairs had already been alerted. He would need an operating room immediately. But now he could reach it alive. Nora stepped back from the stretcher and allowed the charge nurse to take over, maintaining the pressure support. "Keep the clamps steady," she said quietly. The nurse nodded. Across the room, the transport stretcher rolled into place beside the trauma bed. The surgical orderly checked the oxygen line and secured the IV tubing. Everything moved with controlled precision now. The panic that had filled the room earlier had disappeared. The crisis had burned itself out. The trauma bay grew strangely quiet. No one clapped. No one spoke loudly. There was only the soft hum of the monitors and the faint tapping of rain against the glass doors outside. The residents who had been arguing earlier now worked silently, securing lines and preparing the patient for transfer. One of them glanced toward Nora briefly, then looked away again. It was not embarrassment exactly, but something close to it. Across the bed, Dr. Mercer watched the wound site one last time before stepping back. His posture had changed. Earlier in the night, he had commanded the room with sharp authority. Now the tension in his shoulders had eased. The confidence was still there, but something inside it had shifted. Recognition. He spoke quietly to the surgical orderly. Move carefully. The pressure placement is holding him together. The orderly nodded and began guiding the stretcher into position beside the bed. The canine remained beside the handler throughout the movement. The dog had not left the SEAL's side once, but the rigid tension in its body had finally begun to ease. Its ears relaxed slightly. The low growl that had lived constantly in its chest earlier had disappeared. It watched Nora again as the team transferred the patient onto the new stretcher. Not guarding now, just observing. The SEAL's eyes fluttered open briefly as the movement shifted the pressure on his side. He was still too weak to speak, but his gaze found Nora for a moment. Recognition passed silently between them. Then the orderly began rolling the stretcher toward the surgical corridor. The canine moved with them automatically, staying beside the handler's shoulder. The doors closed behind the transport team, and just like that, the trauma bay was empty. The adrenaline drained out of the room in a quiet wave. One of the residents exhaled slowly. Jesus. No one answered. Across the room, the nurses began resetting the equipment. Blood-soaked gauze disappeared into biohazard bags. Fresh linens replaced the stained ones on the trauma bed. The monitors were powered down. Everything returned to the neutral appearance of an ordinary hospital room. But the people in it had changed. The resident who had challenged Nora earlier approached her slowly. He looked like he wanted to say something, but the words refused to arrive. Finally, he settled on the simplest option. You handled that well. Nora gave a small nod. Team effort. The answer gave him an exit. He took it immediately. Across the room, Dr. Mercer approached next. He stopped beside the supply cart Nora had been using earlier. For a moment, he said nothing. Then he spoke quietly. You should have mentioned that background sooner. Nora met his gaze calmly. I wasn't asked. Mercer considered that answer. He nodded once. Not apology, but something close. Then he turned and walked back toward the nurses' station. The room slowly emptied as the team returned to the rest of the night shift. Within minutes, the trauma bay looked exactly the way it had before the patient arrived. Only one person remained. Nora stood beside the counter where the used equipment had been laid out. Her hands rested lightly against the metal surface. For the first time since the ambulance doors had opened, the tension left her shoulders. The silence felt heavier now, because the moment had passed, and the control she had held over herself during the emergency began to loosen. The memories came back quietly. Dusty medical tents, helicopters arriving under floodlights, working dogs pacing beside stretchers in places where hospitals did not exist. She closed her eyes for a second, just long enough to steady herself again. Footsteps approached behind her. The military liaison had returned from the surgical corridor. He stopped a few feet away. The patient made it upstairs, he said. Nora nodded. Good. The liaison studied her for a moment. The code phrase you used. Nora didn't respond. That protocol isn't taught in civilian medicine. Still no response. The liaison's voice softened slightly. You served with people I know. Nora looked at him then. Her expression remained calm, but her eyes carried a quiet warning. The liaison understood immediately. Some histories were not meant to be discussed. He gave a small nod. Well, he said quietly, thank you. It was not the way civilians usually said it. It carried the tone of someone acknowledging a fellow professional, someone who understood exactly what had been done in that trauma bay. Then he turned and left the room. Nora stood alone for another moment. Then she picked up the next supply tray and began resetting the cart for the next patient. By the time the surgical doors closed upstairs, the night in the emergency department had begun to soften. The rain outside had slowed to a light rhythm against the glass of the ambulance bay. Through the high windows at the end of the hallway, the sky over San Diego had begun to turn from black to a thin, cold gray. Inside the ER, the fluorescent lights still burned bright, but the edge of the night had dulled. The trauma bay, where the SEAL had nearly died, looked ordinary again. Fresh sheets on the bed, clean stainless steel counters, new instrument trays laid out for the next emergency. Anyone walking in now would have seen nothing unusual, only the quiet machinery of a hospital returning to routine. At the nurses' station, the early shift had begun to arrive. Coffee cups appeared beside computer monitors. New voices replaced the tired ones from the overnight staff. Charts were exchanged quickly as the night team handed over patients. But fragments of the night's story had already begun to move through the hallway. Small pieces of conversation drifted from one corner of the ER to another. I heard the dog almost attacked security. No, it was protecting the handler. They said the rookie nurse handled it. Which nurse? I'm not sure. The details traveled quickly, but never completely. No one seemed to know exactly what had happened inside Trauma Bay 1, only that something unusual had taken place. Near the back wall, Nora Vance stood beside a supply cart, restocking equipment with the same quiet focus she had shown at the beginning of the shift. She replaced fresh gauze in the drawer, checked the suction connectors, reorganized the medication tray. The work looked routine, because that was exactly what she intended. Across the station, Dr. Mercer finished reviewing the overnight case reports. His eyes moved briefly toward Nora. Earlier in the night, he had watched her with suspicion. Now something else lived behind his expression: respect. He walked toward the supply cart. Nora. She looked up. The patient made it through surgery prep, Mercer said. They're taking him straight into the operating room. Nora nodded once. Good. Mercer studied her for a moment. You handled that situation well. The words were calm, professional, not dramatic. Nora placed another instrument tray into the cart. We had a good team. Mercer almost smiled. That answer told him everything he needed to know. Across the hallway, the military liaison stepped out of the elevator. He walked through the ER quietly, scanning the room until his eyes found Nora. He approached without drawing attention. The dog's calm now, he said. Nora glanced toward the hallway. The K9 stood beside a uniformed handler who had arrived from the naval base. The animal looked completely different now, relaxed. Its tail hung loosely behind it, but when its eyes found Nora across the room, the dog stepped forward slightly. The handler allowed the leash to slacken. The K9 approached slowly until it stood a few feet away from Nora. For a moment, neither of them moved. Then the dog lowered its head slightly, a small gesture, but unmistakable. Trust. Nora reached out carefully and placed her hand against the animal's shoulder. The dog remained still. The handler watched quietly. You're the one who calmed him earlier, he said. Nora nodded once. He was protecting his partner. The handler studied her for a moment. That phrase you used. Nora's hand slipped away from the dog's shoulder. Take care of him, she said instead. The handler seemed to understand the boundary. He nodded. The dog gave Nora one last look before turning back toward the hallway with the handler. The leash tightened slightly as they disappeared toward the elevators. The military liaison remained standing nearby. They're going to ask questions, he said quietly. Administration. Command. Nora closed the supply cart drawer. They can. You could go back, the liaison added. People with your background usually don't stay in civilian hospitals. Nora looked at him calmly. I know. You saved one of ours tonight. She picked up a patient chart from the counter. That's what we do here. The liaison studied her face for a moment longer. Then he nodded. Understood. He turned and left the ER without another word. The morning shift continued to gather around the nurses' station. A patient call light blinked from one of the hallway rooms. Nora walked down the corridor and stepped inside. An elderly woman sat on the bed waiting patiently while an IV line beeped softly beside her. Nora adjusted the tubing, checked the flow rate, pulled the blanket gently over the patient's legs. Her hands moved with the same calm precision they had shown during the chaos earlier that night. The fluorescent lights hummed quietly overhead. Outside, the first pale light of morning spread across the hospital parking lot. Inside the ER, the night's crisis faded into routine, and Nora Vance moved on to the next patient as if the story of the wounded SEAL and the guarding K9 had never belonged to her at all.